0845 6060 973.
We've got 8 minutes before 8 is the time. Back to our conversation about events in Russia in a moment. But let's focus on events here in the UK. And as we know, we now have the date that England can move to so-called throwing off the shackles. And more on that now from Health Secretary Sajid Javid, who I note has an article in one of the newspapers today, the Sun newspaper. COVID is now part of our normal life, but be careful out there. Sajid Javid joins me now. In what way do my listeners, and do indeed the good folk of Bromsgrove, in what way do they need to be careful, Secretary of State? Good morning.
Well, good morning. And look, yesterday was a historic day. We were already the freest country in Europe, but thanks to the defences that we've built and the great efforts of the British people, we were able to go further. And we should, I think, never forget that the restrictions we've had on daily lives, although they had an important purpose, they were never intended to become part of daily lives in some kind of permanent way. They had a huge cost on things like education and people's jobs and livelihoods, on non-COVID health like mental health, and that's why these steps were important. The answer to your question in particular about being careful, of course, we can now safely take these steps, but COVID hasn't gone away. We might be done with it, but it's certainly not done with us. And that means we need to remain cautious and vigilant. And that is also why the government announced yesterday, first, that we will continue to build our defences, especially our primary defence, which is vaccination. And that's why I accepted the further recommendations of the JCVI, our independent advisors on vaccinations, yesterday. And also, we will continue to keep in place a world-class detection system. We'll call it a surveillance system. So if there are new variants of concern, we will know about it and know about it early, and we will be able to respond quickly.
How? How will we know about it if there's not the same level of testing, Secretary of State?
Because we've had a number of surveillance systems in place that certainly I, as Health Secretary, have relied upon immensely, especially during the Omicron wave. And the primary one has been one run by the ONS, that's the Office of National Statistics, where they test tens of thousands of people using PCR tests every week. And that provides very granular data for us about what's going on around the country. Alongside that, by the way, we also have two other smaller testing systems, but still very valuable. One's called Vivaldi, which is about testing in care homes. Another one's called Siren, which is about testing in hospitals. And those two will remain in place. I think taken together, it gives me the information I need to know what's going on in the country. And at the same time, we will keep open lab capacity. We will have our genomic sequencing capability kept open. And with other measures, it means that we can respond very quickly.
Noting that the tone from the Downing Street press conference yesterday was positive, but indeed a degree of caution.
Yes.
Can we be sure, if you say that's a fair characterisation, can we be sure there won't be another wave and that we might one day have to return to face masks, lockdowns and other restrictions? Mr. Javid.
I think it is a fair characterisation what you said, Nick, and I think what that press conference, what certainly Chris Whitty and the Chief Science Officer, they recognised is that there is uncertainty out there. We can be certain, I think, that there will be another variant. I think there's near scientific consensus on that. We just don't know if it's going to be more dangerous or something that is not too different from Omicron. But we will be prepared, and that's really the message yesterday. And we can all continue to play our part in those preparations of keeping our defences strong by getting vaccinated. And as I say, that yesterday there was a recommendation to have a second booster, if we call it that, for over 75s, for older people living in care homes, for the immunosuppressed over the age of 12. And I've accepted that, and that will start in the spring, and we will continue that defence. But also, it's worth thinking that this thing is still out there, and we've all got a role to play.
So can we rule out restrictions or lockdown again, Secretary of State?
Well, I hope we never have to go there again.
We can't rule them out, though, can we? I hear.
I don't think it would be sensible to say that any such act. You asked me about face masks and things. That I don't want to see that again. But I think that by focusing on the defences that we do have, the vaccinations, the treatments, the antivirals. By the way, we've got more courses of antivirals per head than any other country in Europe. the other treatments that we have, the testing that we will continue for more vulnerable, the testing that we will continue in vulnerable settings. I think these are the right set of measures as we look ahead.
What do you plan to do as regards face covering personally, Secretary of State? Will you continue to wear one on public transport? What's your plans?
For now, although the infection levels have been falling significantly, week after week, I think where infection levels are at the moment, if I was on, the London Tube, for example, and it was packed, I would wear a face mask.
How will you know not to? When would you be comfortable not to wear the face covering?
I think that I personally, if you're asking me, I would, and it's right that these are now personal decisions. We want people to take more personal responsibility around this. Of course, we'll set out guidance. Is that I would look at what's the general prevalence of where case numbers are, where infection numbers are, what hospitalization numbers look. We provide that data on a daily basis. It's there for everyone to see, and I think taking all that into account, I would make a decision. I would also actually think about what defences I've got, and one of the strongest defences I have, which I know that the vast majority of the British people do, because over 90% came forward to get vaccinated, are those defences that come from that process of vaccination.
Not everyone shares your note of optimism here. Professor Stephen Reicher, who's from the University of St Andrews, who's someone you possibly know of, or maybe indeed know, is suggesting that it's not fair that the free testing has gone. They can't afford necessarily to pay the £5, and the fact that the £500 were you to need to self-isolate comes to an end as well. In his view, that's desperately unfair, particularly on the lower income end. Secretary of State?
Well, we would continue free testing until the end of March, and after that, it will be much more targeted, so there won't be a universal offer. But I do think that's the right balanced and proportionate response. I just don't think, given where we are, given what we now know about this virus and all the other defences that we have, it would be sensible for the country to continue spending around £2 billion a month on testing, when we can take some of that money and, for example, put it into making sure that we're getting through that waiting list in the NHS a lot quicker. We can put it into primary care. We can put it into social care. So it's important that we take a balanced and proportionate response, and I think that's what we set out yesterday.
As the boss of the NHS, perhaps you can answer this question from Tina in Edmonton. Can Mr Javid guarantee NHS staff will get free testing before they do a shift?
What I can guarantee is that NHS staff, if they need a test, they will receive that test for free as part of their employment.
And that's ongoing, Secretary of State?
That will be a decision, how long that goes on for and how often it is, and that will be a decision for the NHS. It's a clinical decision. That's my point. It's not a decision for me as the minister sitting in London. So, for example, Nick, the prevalence of the virus could be different in different regions. So it's perfectly possible that one part of the NHS, a trust, might take a decision to test more frequently than another. And so that is a clinical decision. It has always been a clinical decision, and it will continue to be so.
So if a nurse, a doctor, an anaesthetist, a cleaner, if they want a test will be made available?
It's a decision for that NHS trust. And they will always make these decisions appropriately based on the very best clinical advice.
I mean, I guess we're coming to this suggestion that there is some kind of unrest between you and your colleague Rishi Sunak over the £5 billion required for COVID tests for health workers. Is there a degree of dissent between you and your colleague?
No, not at all. In fact, when it comes to my colleagues, in particular the Chancellor, Rishi Sunak, I couldn't wish for a better colleague and better cooperation. I think we're lucky to have the teamwork that we have in this government.
So we go back to those joyous days of a couple of Christmases ago when you were photographed at the Star Wars movie, The Rise of the Skywalker, with your arm around him. You are in accord, marching as one.
We can't wait for the next Star Wars movie. I don't know when it's coming out. Do you?
I don't. Secretary of
I'll
State,
ask Rishi. He probably knows.
Rishi will know once he gets his sandals on.
I will ask him.
He will find out. Right, that's covered that matter. One other thing I need to get a word from you on, obviously, is events overnight in Ukraine. Do you imagine that what do you imagine we might hear later today? Are we going to move to economic sanctions? How concerned should my listeners be by Vladimir Putin's rather bizarre retelling of history last night?
Look, we should all be very concerned. It's a very dark day that we're waking up to in Europe. What we've seen from Russia in the last 24 hours is clearly a flagrant violation of Ukraine's sovereignty, its territorial integrity. It's a violation of the accords that Russia had signed up to. And as you'll know, and no doubt you've covered, that the Cobra committee is meeting right now, and the Prime Minister later in the day will make a statement and set out what action we will take, and we will take action because the Prime Minister has been clear throughout this crisis that we won't hesitate to do so.
Sanctions, lastly, Secretary of State, economic sanctions?
There will be sanctions. The Prime Minister's been clear about that. I couldn't tell you what those are right now. That's the point of the Cobra. But
possibly
it is
what are called high net worth Russian individuals living here, allies of Vladimir?
I am sure that from what's already been shared by the Prime Minister, that individuals that have close contacts with the Russian regime will be targeted, as will, I think, certain economic sectors.
Grateful for your time. Thanks very much indeed. Sajid Javid, Health Secretary, appearing here on LBC, where it's 3 minutes after 8. Thomas Watts has the news.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, the Health Secretary Sajid Javid has said Russia has chosen confrontation over dialogue.